Good afternoon, and thank you for attending today's briefing. I'll start with a short update on the COVID-19 pandemic situation in the Northwest Territories. On April 3rd, I declared an outbreak at the Diavik Diamond Mine after a second COVID-19 infection was confirmed. There have been no additional cases of COVID-19 since the outbreak was declared. The Office of the Chief Public Health Officer is working closely with Diavik to ensure the two individuals infected by COVID-19 and all contacts are safely self-isolated. The company is testing all employees at the mine site and is working with public health officials to contain this outbreak and mitigate transmission risk. So far, we have been successful in doing so. We are on day 12 since the cases have been isolated. 3 recent COVID-19 infections, 2 at Diavik Diamond Mine and 1 from an NWT resident that was related to international travel, have now been identified as variants of concern. The B.1.1.7 variant first identified in the United Kingdom. All 3 cases have this UK variant. So while research is underway nationally and internationally to better understand the impact of these variants of concern, such as how they are spread and the severity of illness they cause, evidence gathered to date is concerning. Evidence suggests that variants of concern are more transmissible, meaning they spread to other people easier. Each COVID-19 infection from a variant will infect more people compared to the original virus. What's more, the evidence is emerging, which shows that variants cause more severe infections in younger adults and more hospitalizations and deaths in this age group. So we can't let variants gain a foothold in the Northwest Territories. Our importation risk is real and increasing right now with COVID infections soaring across the country. And specifically, this increase, this third wave, are due to variants. So what that means for us is there's less room for error in how we implement and follow public health measures. We need more and more people to do the right thing, get vaccinated if they can, and continue to do the things that we know work at reducing the spread of COVID-19. While the arrival of a variant in the Northwest Territories is not welcome, it's also not unexpected, and we have been preparing to handle them. The GNWT already has in place strong public health measures to reduce the risk of transmission of variants of concern in the Northwest Territories. These are border controls, travel restriction, and self-isolation requirements. And you have been helping us with this effort by following the measures in place and listening to the recommendations that we have been provided. And current public health management in the Northwest Territories for contact and case management is robust and supports the identification and management of COVID-19 and variants of concern. We routinely monitor the variants of concern through laboratory studies. All samples that are positive for COVID-19 are sent to the Alberta Precision Laboratory to try and screen for any variants of concern. And I know the identification of variants of concern in our territory is going to worry some of you, and that's natural and that's understandable. I also want you to know that we have the power to stop the spread of variants in their tracks. The same preventive measures that protected you and your communities from the original COVID-19 virus are effective against these variants. So this includes keeping physical distance of 2 meters or 6 feet apart, washing or sanitizing your hand a lot, wearing a mask, especially when in indoor spaces, keeping crowds small and spaces large, staying home when you're sick, even if your symptoms are mild, calling your healthcare provider or accessing testing if you have any symptoms of COVID-19, and self-isolating responsibly when required. We also have an additional preventive strategy that was not open to us when this pandemic first started, and that is access to a highly efficacious COVID-19 vaccine. If you are an NWT resident, and over the age of 18, you can access the Moderna vaccine in the Northwest Territories. For more information, you can contact your local healthcare provider or go to the GNWT Response to COVID-19 website. If you are a non-resident rotational worker or a new resident and want to be considered for the vaccine, you can email cpho@gov.nt.ca. Provide your details regarding the nature of your work and how long you'll be in the Northwest Territories for consideration of the vaccine. The more people that access the vaccine, the safer we are making our territory. I will now talk a bit about our vaccine program. As of April 3rd, 24,103 first doses and 14,471 second doses of the COVID-19 vaccine have been given across the Northwest Territories. Our team is working hard to crunch the numbers on exact vaccine coverage regionally and territorially. While the number of vaccines delivered in the Northwest Territories is impressive, that count also includes rotational non-residents. So we are going through the data very carefully to ensure that we are truly counting those who contribute to community protection and that their numbers are included. And we do plan to share these numbers with Indigenous and community leaders first, and then the public afterwards, so we can all work together to support our vaccine uptake. You will notice I have been using the term community protection instead of herd immunity lately. That's because we cannot truly achieve herd immunity in the Northwest Territories yet. A significant portion of our population, those under 18, are unable to be vaccinated at this time. And research is being conducted to approve Moderna for a younger age category, but this still needs to be approved before we can offer this to our younger residents. So while we have measures in place that have worked to protect the Northwest Territories from COVID-19, the virus is tenacious in how it infects people and will find its way back into the territory through travel, potentially in the form of a variant, like what we have experienced recently. These new variants are highly infectious and extremely dangerous, and as I mentioned earlier, widespread infection would be devastating to our healthcare system and our communities here in the Northwest Territories. But there is excellent data that shows the Moderna vaccine is effective against the UK variant, and we expect more information about its effectiveness against the other variants. We will follow the evidence as it emerges. I do want to encourage anyone who has not received the vaccine to do so, and for anyone due for the second dose to book their appointment as soon as possible, as soon as they're eligible to be protected against the COVID-19. So that's a minimum of 28 days. The second dose of the vaccine ensures stronger and longer lasting protection, and it takes at least 14 days after your second dose for you to be considered fully vaccinated. I do realize that some of you may be hesitant to receive the second dose because you have heard of their side effects. And we do know that side effects are more common for the second dose. But I do want to reassure you that these side effects are typically mild, but they can be moderate because they may impact people's ability to perform the daily routine. These side effects typically last a day or two after vaccination. These common side effects are a sign that your body's immune system has kicked in to build immunity against the disease. Even if you don't have any side effects, the vaccine is still working. And if you experience more severe side effects like any vaccine, you should reach out to your healthcare provider and they can help you. I also want to reassure you that there have been 0 deaths in the Northwest Territories related to the COVID-19 vaccine. Any adverse events are being reported to the Public Health Agency of Canada. We have also been getting questions about a vaccine passport for use in domestic travel. And when will this become available to the Northwest Territories residents? Requirements for any formal documentation like this must be agreed upon nationally, and we will cooperate with the federal government to ensure we have what is needed to support whatever solution is agreed upon. But it's not up for the Northwest Territories to decide. You may also notice some of our GNWT communication staff out and about in your communities, providing information about the vaccine and helping book appointments if needed. Reach out and say hello to them. They are there to support you in making an informed choice about the vaccine. We also have about 50 local community champions from all over the Northwest Territories. They are going door to door or working in information booths at high traffic locations. We are doing everything we can to remove any barriers preventing residents from accessing vaccine clinics or difficulties with booking appointments. We are also considering alternative clinical options that Dr. Pegg will describe in further detail. Finally, our colleagues at 811 are also helping people book vaccine appointments online in Yellowknife and providing information about how residents can book in other NWT communities where processes may be slightly different. So I urge you, get vaccinated now if you haven't already. Getting vaccinated is one of the best ways to protect yourself, your community, and our territory against COVID-19. For those of you who have already been vaccinated, you are our greatest champions right now, and please encourage your friends and family to do the same. Before I turn things over to Dr. AnneMarie Pegg, I do want to speak about our path forward as we continue to navigate this pandemic. So I know it's been very challenging to everyone, and we have made a lot of sacrifices as we have fought this virus together. Many of you are tired. You want to gather, you want less restrictions, you want to travel, you want self-isolation requirements to be eased. So I want that too. But COVID-19 is stubborn, and it won't go away all by itself. I am committed to update Emerging Wisely and releasing it publicly so we can give it to our residents, businesses, and communities, and they have more certainty in what needs to happen for public health restrictions to be eased and how we're going to do it. Things have changed since we released Emerging Wisely last spring. What we know now, like how quickly vaccines became available and the emergence of variants of concern, and the third wave, we did not know then. That new knowledge will shape our path forward. And because we'll continue to learn more about this virus, that means we'll have to be flexible, patient, and measured in our approach to easing public health restrictions. So what happens beyond our borders matter. As COVID-19 infections soar in several jurisdictions across Canada, we don't want that to happen in the Northwest Territories. We don't want terms like circuit breaker and lockdowns to become commonplace in our territory, and they don't have to be. If we continue to do the right thing and we continue to make wise choices in the coming months, both individually and collectively, we can maintain our course. And I do want to caution everyone that when the updated Emerging Wisely is released, we won't be snapping our fingers and returning to the way things were before COVID. Now is not the right time to do that. But we are in an enviable position in the Northwest Territories. Our number of cases remain low. We have enough vaccines in our territory for anyone who is eligible to access them. And we already enjoy a level of stability that others in places in Canada do not currently enjoy. These strengths are why we can plan to ease some measures as we gradually emerge from this pandemic. The first measures eased as vaccinations rise locally will likely be small local ones, such as outdoor gatherings and increasing capacity for businesses. And as vaccinations progress across the North and Canada and transmissions start falling elsewhere, more targeted and permissive self-isolation protocols and travel restrictions may be considered. When the evidence shows it's safe for residents, we will start to reduce restrictions. Until then, let's continue to follow public health orders and recommendations. Let's continue to be kind to each other. Let's continue to keep our communities and families safe. Together, we are defeating COVID-19. Thank you for your time.
Thank you, Dr. Kandola, for those remarks. I'll now turn it over to Dr. Pegg. Dr. Pegg.
Thank you very much. First of all, I want to recognize the efforts of both residents and staff across the NWT over the past 3 months. This vaccine campaign has been a major effort and one that would not have been possible without the above and beyond efforts of health and social services system staff, but most importantly, of course, the people who have showed up to get their shots. By the end of next week, we will have coordinated 3 vaccine clinics in each NWT community, giving residents the chance to receive the COVID-19 vaccine. This is an enviable achievement. Many people across Canada and worldwide are still waiting their turn. This was a major undertaking that involved significant logistical challenges, but one that we were able to deliver on as planned. As we move past this milestone of the 3rd round of clinics, we'll be planning for ongoing vaccine access for the residents of the Northwest Territories. This will mean moving away from regular touring clinics to an on-demand approach for people who still wish to receive a vaccine. In hub communities, vaccine will be accessed through regular booked appointments at your public health units or health centers. For our smaller and more remote communities, anyone who wants the COVID-19 vaccine will call their health center as they would for any other vaccine, and we will determine the best way to ensure that people get timely access. This would include planning for on-demand mini clinics in communities if this was deemed necessary. Once the details are finalized, they will be available at nthssa.ca/COVID-vaccine. And we will communicate processes for all communities here and through other media for those who are not able to access the internet. If you want a COVID vaccine, but don't have an upcoming clinic or know how to get one, simply visit our website or contact your health center for more information. I would also like to acknowledge the exceptional efforts of the teams in providing vaccination to Diavik Mine, where we vaccinated over 200 workers, both Northwest Territories residents and rotational workers, both of which will contribute to keeping our community safe. There was excellent collaboration between the Office of the Chief Public Health Officer and Diavik medical authorities to ensure that this campaign went smoothly. Before we move on to questions, I also want to recognize the efforts of territorial residents. Everyone who stepped up to get vaccinated, thank you for doing your part. I also want to thank everyone for continuing to follow our public health guidance. These are our best measures to continue to keep our community safe. For everyone who has not yet gotten the vaccine but is considering it, I encourage you to reach out and discuss this with your healthcare provider or contact us at NTHSSA, and we'll be happy to provide information for you. Over the coming weeks, we will continue to work towards providing useful information to everyone who is still considering whether or not to get their shot. This will involve communication campaigns and work to reduce barriers for access. For example, specifically in Yellowknife, starting April 12th, we will be adding a walk-in option for our vaccine clinic from 11 a.m. to 3 p.m. at the day center at Centre Square Mall. We are also looking at opportunities for mobile or pop-up clinics throughout the city. This work is in addition to community outreach that has taken place across the territory. For communities that have not yet had their 3rd clinic, look for people doing outreach in your community and ask them questions if you have them. As we work towards our goal of ensuring as many residents get vaccinated as possible, I encourage everyone to continue to work together to follow the public health advice and continue to support and be kind to one another. This pandemic is not over, but we're making progress. Let's keep up the good work. Thank you.
Thank you, Dr. Pegg, for those remarks. We'll now turn to the question and answer period. And first off, Megan Brackfrey from Cabin Radio, do you have a question for either Dr. Pegg or Dr. Kandola?
Hi, yes, can everyone hear me all right?
Loud and clear.
Perfect. I believe this would be for Dr. Kandola. Thanks everyone for your time today. I guess I'm just wondering, I know, again, you said you're committed to reviewing the Emerging Wisely plan. I'm wondering if the emergence of variants in the NWT affects that plan and how that might affect the review.
Thank you for that question. So when we're reviewing the Emerging Wisely plan, it would be taking a measured approach. We'd be looking at the 3rd wave. Unfortunately, most of Canada is now entering the 3rd wave, and it's been mainly fueled by variants of concern, and it will become the dominant strain, unfortunately, in the weeks to come. However, the good news is that vaccines are continuing to roll out in greater numbers across Canada. So if we are to look at the phase 3 component of emerging wisely, we need to time it to those activities that can be done where there is minimal risk of spreading events. And so we do know that outdoor activities are much less riskier than crowded indoor activities, especially when there's poor ventilation. So we'll start with easing measures around the less riskier outdoor activities. And then when we are looking at high risk activities, we need to coordinate that with the vaccine rollout that we'll see in the rest of Canada and a dampening of the third wave that we're currently experiencing.
Thank you, Dr. Kandola. Megan, a follow-up for either of the doctors?
Yeah. My second question, for the better part of a week, there's been a trace of COVID-19 signaled in Fort Smith, according to the GNWT dashboard. I'm wondering if anything is being done to investigate that and what's thought to be the likely explanation.
So that trace signal in Fort Smith is only one sample right now. And typically, when we do public health action, we look at the trend. So we are waiting for another sample from Fort Smith to be analyzed by the National Microbiology Laboratory in Winnipeg. And if the signal amplifies or if there's cause to be concerned to see that this is a signal that's increasing and that possibly it's an unanticipated signal, we would do a public health action. The issue is we do experience a lot of trace detects. It's very it's a small signal, and it could be transit. Someone could have traveled in and traveled out, but it's a persistent signal that's starting to have increased amplification that causes us concern. So with the Yellowknife and Hay River wastewater signals, when we did a public health advisory, is because it was persistent and it was amplifying.
Thank you, Dr. Kandola. Next, Ryan from the National Post, do you have a question for either Dr. Pegg or Dr. Kandola?
Yeah, hi there. I've been looking at your vaccination rates, and you talked a little bit about the numbers today. Obviously, like you said, they're much higher than the rest of the country. I know that was a deliberate decision to ship more vaccines to all of the Northern Territories. I'm wondering if you can talk about why that was important, why you needed the vaccines, and I know this was a unanimous decision with the other provinces, but why it was important to get the vaccines there so quickly.
First of all, on behalf of the government of Northwest Territories, I just want to express gratitude to the federal government and for the provinces to be very supportive in considering all three territories has a vulnerable population in and of itself. So I'll speak specifically about the Northwest Territories. Northwest Territories, we have 33 communities, over 1.2 million square kilometers. Some of those communities don't have permanent nursing staff, and other most communities are managed by community health nurses. We have one main hospital in Yellowknife that does have ICU capacity. But given the complex social determinants that our Indigenous population faces, and they represent over half our population, and given the crowded conditions, pre-morbid conditions, we know that if we were to experience the entry of a COVID-19 virus within our communities, it could spread pretty quickly. And that's because we have been fortunate with our travel restrictions and with our mass gathering orders, as well as a quick rollout of the vaccine. We've been very fortunate that we haven't experienced what we are seeing in other Indigenous communities across Canada. But without those measures without having the vaccine provided to us in the first quarter, we would be very vulnerable. Um, an outbreak could quickly overwhelm our healthcare system. And so one of the fortunate decisions that have been made is that we were advanced enough vaccine in the first 3 months to provide vaccine up to 75% of our eligible residents. And that's been really critical because we have been using public health measures, travel restrictions, and mass gathering orders. But public health measures was buying us time to get a very quick and efficient vaccine rollout, which we have been able to achieve. However, with the variants of concern, we need to try to increase our numbers even higher than what they are right now. Right now, we have 61% of our eligible NWT resident population vaccinated for the first dose and about 39% vaccinated with the second dose. We have a significant number of residents, people living in the Northwest Territories who have an active healthcare card from another jurisdiction, so we don't necessarily count them in our coverage. 61% is good, but we need to be much better than that.
Dr. Pegg, I don't know. I wonder. I wanted to give you an opportunity to maybe also respond to Ryan's question. I don't know if you have anything to add.
Yeah, sure. I mean, as was mentioned by Dr. Kandola, that we have a number of communities with extremely limited healthcare infrastructure. We also can't discount the role of geography and the dependence that we have on air transfer. Should there be even a small number of cases in a small community that required transfer to a higher center, that would very quickly overwhelm our air transport resources and possibly mean that other services requiring air transport would not be available. We also, with our limited ICU capacity, are not able to provide all of the complex ICU level care that is required for the sickest COVID patients, and that too necessitates transfer out of the territory, which is further strain both on our infrastructure resources and our transfer resources. So to echo Dr. Kandola's statement, that the public health measures have done a great job so far at protecting our healthcare system. And we're very grateful for the allotment of vaccine that's been provided to us. And with the variants of concern, we remain very vigilant given the precarity of our healthcare system in certain areas. Thank you.
Ryan, do you have a follow-up question for either of the doctors?
Just as a follow-up, you talked about having 61% of coverage and needing to go further. I know just because you guys are so far along, at what percentage level do you think you would be comfortable easing restrictions? And then I was also hoping you could touch on, some of the logistical challenges. I know the Northwest Territories has a lot of flying communities. Was it challenging to roll out the vaccine to those communities?
I can start with the first half, and Dr. AnneMarie Pegg can talk about the logistical challenges. So what level of comfort? So 61% coverage is the adult population, but if you factor in the fact that everyone under 18 is not immunized, that drops down even further. So the comfort level with what I'm anticipating right now in the days to come, that when we do have a COVID case here, it'll be a variant of concern unless proven otherwise. And because of the increased infectiousness and increased severity, would be at minimum, if we could push it to 85% coverage in the adult population, that would be great. Because the more we can cover, the more we protect ourselves, but the less impact an outbreak would have on the healthcare system. So if we can, where we're able to, people who are eligible for the vaccine, it'd be great if they can get vaccinated.
I can speak to some of the logistical challenges that we face with the vaccine rollout. Certainly geography was the biggest one, coupled by weather, probably the second, and the complexity of transport of the vaccine itself, given its specific storage requirements. We had a very dedicated and skilled team that were able to map out the rollout of vaccine clinics to each of the communities in the Northwest Territories, with the eye to minimize at all costs wastage of the vaccine. And so it was a complex balance between ensuring that there would be enough vaccine for everyone who would want to be vaccinated during a specific community visit, but also not overshooting that too much, which would have led to waste. And I'm very, very proud to say that the waste in the vaccine rollout in the territories was extremely minimal, and that's really been due to the extraordinary efforts of the vaccination team. So I would say that coordinating the delivery, making sure that none of the vaccine became spoiled or was outside of its storage requirements, speaks to the skill level of our team. And the fact that we were able to do so with essentially no wastage has also been an incredibly strong point.
Thank you, Dr. Pegg and Dr. Kandola, for that.
Sorry, Darren, you're on mute.
Yeah. Sorry about that. Thomas Shabbat with Radio Tiger, do you have a question for either Dr. Pegg or Dr. Kandola?
Yeah, actually, yes, I would have a question for both of you, actually. What will be the new guidelines to move to the next phase in the Emerging Wisely plan?
So that would be myself. Next week we'll be releasing some information about preliminary orders, and then after that we're currently working on phase 3 relaxing measures. However, we do have a third wave. The phase 3 was in anticipation that the second wave has come and gone, but no one anticipated in the space of a week how quickly we would go into a third wave and how quickly the variants of concern have increased. They're about close to 17,000 variants of concern right now that we have had in Canada, and that's when we had our first entry was in late December. So if we are looking at moving to a phase 3, we would start looking towards the end of April for some preliminary easing, and then a second phase of easing based on the vaccine rollout and where the third wave is going in the rest of Canada.
Thank you, Dr. Kandola. Thomas, a follow-up question?
Yes. I was wondering also about the live music shows. Is there a precise plan to re-allow them in the Emerging Wisely plan?
So events such as like Folk on the Rocks, which largely take place outdoors, has less of a risk than having an event in a crowded indoor setting. And so currently we are reviewing them on an exception basis based on mitigation plans. When you are looking at phase 3, we would start with easing measures on outdoor gatherings because that is a lot less riskier. And depending on where the third wave in the vaccine rollout goes in the rest of Canada, then we would also start easing measures around the indoor gatherings. And with indoor gatherings, such as having live music shows in an indoor environment, it's one of the riskier ones, but we would look at it and make sure there's mitigation measures in place. The more people we can vaccinate, the less risky it would become for the territory as a whole.
Paul Bickford from Hay River Hub, do you have a question for either Dr. Pegg or Dr. Kandola?
Sure, thanks. Dr. Kandola, I understand that the GNWT has recently issued evacuation guidelines for the upcoming spring breakups, I guess, of the number of rivers. And I understand that your office was either involved in the preparation of those guidelines or reviewed the guidelines. I'm not certain, but could you comment on the guidelines, especially in reference, or in particular in reference to the COVID-19, and how these guidelines prepare or foresee what might be happening for COVID-19?
I think thank you, Paul. These guidelines were prepared by MACA, so I would refer that question to MACA specifically, because they did consult our office around the evacuation guidelines, but they're the lead on those guidelines, and they would incorporate public health measures, but OCFO was not the lead on that, and I would defer that question to Municipal and Community Affairs.
Paul, do you have a follow-up question for either Dr. Pegg or Dr. Kandola?
No, that's it. Thank you.
Okay, thank you, Paul. Brett from CKLB, do you have a question for either Dr. Pegg or Dr. Kandola?
Yes, thank you for taking my question. Health Minister Green had previously mentioned the government of the Northwest Territories was unsure if the vaccine prevented spread of the virus. So I'm just curious, are there any updates on whether the Moderna vaccine efficiently prevents spread of the COVID-19 virus?
Thank you. That's actually a good question. So there is real world data looking at a messenger RNA vaccine, which is the Pfizer, and Moderna has the same vaccine platform, has Pfizer, and that was in Israel, where 10 days after people had received the second dose, they saw a significant drop in spread in people who had no symptoms. And then there was another study that was done in the US looking at healthcare workers who are routinely tested, and they saw a significant drop in asymptomatic spread in people who are vaccinated. So these results were promising, and they were not peer reviewed, but they were enough for CDC to take action. And so CDC has published guidelines around people who are fully vaccinated, what they can't do. Because the extent of reduction and because these findings were not peer reviewed, other countries have not used it to inform policy change.
Brett, do you have a follow-up question for either of the doctors?
Not at this moment. Thank you very much.
John Last, do you have a question for either Dr. Pegg or Dr. Kandola?
Yes, thank you. I have a question for Dr. Kandola. You'll have to forgive me. I'm asking about something that probably feels a little bit like ancient history. But back in March, when the border restrictions were first introduced, Mike Harrison crossed the border illegally, and you issued a statement condemning him for doing that. In May, an investigation by your office recommended that you lay charges for that health violation, for violating the Public Health Act. But no charges were ever laid, so I'm wondering why you decided not to lay charges in that case.
So that I can't speak specifically about the investigation for specific individuals, but it was investigated, and a decision was made, and no charges have been laid, but it was followed up and investigated.
John, a follow-up question for either Dr. Pegg or Dr. Kandola?
Yeah, just to follow up on that. So given the fact that no charges were laid, he was never charged with any crime, and that he was sort of very publicly named and shamed in that instance. Is there anything that you regret about how that specific case was handled and how you directed your response to that issue?
What we're asking everyone is, at this point, if you're required to isolate, that you isolate responsibly. It's that much more urgent right now with variants of concern. So we do encourage people, if there are public health orders in place, to follow the public health orders, because by following the public health, you protect everyone, and COVID's not a game. Unfortunately, with the new variants and just how quickly they can spread, if people are not following isolation orders, it puts everyone at risk. This is just what I can say about that.
Thank you, Dr. Kandola. Garrett Hinchy with CBC North, you have a question for either Dr. Pegg or Dr. Kandola?
Yeah, thank you. I think this is for Dr. Kandola. So we've now had 2 declared outbreaks at diamond mines in the territory, and now there's a case that's been announced at a caddy that's been caught in an outbound worker. And I'm wondering, given that that seems to be kind of the majority of the cases that we're seeing in the territory over the last couple of months, whether or not your office is considering additional restrictions on mines or changing the approach that you guys have to dealing with outbound mine workers, and then maybe just generally a bit about the role you guys play in their, I guess, COVID testing and COVID prevention measures.
Just for clarification, the Office of Chief Public Health Officer had never released anything around the caddy mine, and we do not have a lab confirmed COVID case in the caddy mine, and so at this point we can't comment on the caddy because that wasn't our announcement. There is no lab confirmed case, but when we speak specifically about Diavik or the GK mine outbreaks, we do anticipate any situation where you're getting a lot of out of territory workers and they're in a congregate setting. It does put it does increase the risk. And so even with travelers coming in, we have an increase of travelers coming in from March break. What I've always stated was we can't prevent COVID from entering NWT. It's going to enter. And right now, any COVID case that we get right now, we will say it's a variant of concern until proven otherwise. So the most important thing is picking up that case, being able to isolate, get the close contacts isolated as well, and try to maintain containment. The difference between the GK and Diavik is at that point, we had not rolled out a vaccination program. In that particular GK mine shift, we did it afterwards, but we were rolling out our vaccines and we were targeting those over 60, and specifically in Yellowknife. Everywhere else, in some of those communities, we had targeted everybody, but there was a significant number of people not vaccinated in the original GK mine outbreak. In the Diavik mine, we had 50% had received either the first or second dose, and with the subsequent 200 plus vaccinations, Diavik had reached close to 90% of the people had received vaccine on site. So that's our one strong public health preventive measure, is that we are rolling out vaccines for oil and gas and mine workers because it is a higher risk setting. The second thing is we did have a mineral petroleum resource order put in place in April last year, which has strong public health measures around social distancing 2 weeks before you go in, testing on arrival, multiple testing now during mines activity, and then on outbound, as well as testing people who are symptomatic, having point of care tests on site, and environmental cleaning and other public health measures. So those are in place in addition to the vaccination measures. So with this particular scenario, we've had 2 cases, close contacts isolated. We're on day 12. Because of all the measures put in place, I'm hoping by Sunday, people would be on day 14, finishing the day 14. Well, day 14 will be pretty much out of the high risk period of the viral incubation period, and everyone should be home by Monday, April 12th. So just like in the mines, just like here in NWT, we're going to get variants of concern. We're going to have introduction. It's just how quickly can we identify, contain, and prevent further spread. So we have come a long way, and I really do feel vaccines have helped a lot, as well as the public health measures we had in place.
Here to follow up.
Yes, thank you. And I appreciate that clarification, Dr. Kandola. This question I think is also for Dr. Kandola, and it's regarding the updated Emerging Wisely plan. One thing in the initial plan that didn't change through phase 3 until we got to the full reopening was the household gathering limit of household plus 5. I'm wondering, considering the rising vaccination rates, whether or not that's something your office is considering revising, potentially allowing for more people to gather indoors before we get to a full reopening of the territory.
So the full reopening for the territory will be full reopening for the rest of Canada, because basically the pandemic would have been declared over. So this is the final step before that. The first, the phase 3 would be done in stages. The easiest stage right now to do the relaxing would be around outdoor gatherings. And then later on, depending on what the third wave looks like and the vaccine rollout for the rest of Canada, we can start easing more on the indoor gatherings, and that includes the household limits in phase 3 as well. I realized that last year we had kept it the same, but we hadn't anticipated getting the vaccine so quickly. We thought it would come between the phase 3 and phase 4. But because we do have vaccine rollout, that can factor in household gatherings. But a 61% vaccine uptake in our eligible population is not a good uptake. It means close to 40% have not received the first dose. And we do know the demographics of who that group of people are, and they are the younger people. So the 18 to 29 has the lowest uptake of first dose, followed by, not surprisingly, the next cohort, which is 30 to 49. So the higher we can increase our vaccine uptake, the less risk overall. This is the best way we can start crowding. I can't pretend that when you decrease the physical distancing, and the more time you spend indoors, the more social contacts you have, that increases your risk if one person does have a variant of concern. Variant of concerns have a higher attack rate. How COVID spreads is pretty simple. The trick is how can we ease restrictions as much as possible and try to mitigate that risk.
Thank you, Dr. Kandola. Simon Whitehouse with Northern News Services, do you have a question?
Yes, hi, Dr. Kandola. I think I've asked this in the past, but I just kind of want to get clarification. Next week, Ramadan starting. I just wondering if you could maybe talk a little bit about the challenges around that, and maybe just how you've addressed those challenges.
Can you clarify specific challenges around the Ramadan Day?
Ramadan and just worship practices.
I know with the fasting and how if you could be clarify what specific to.
I suppose it just means just faith-based gatherings and just sort of what's unique over the period of a month type thing, I suppose.
Yeah, so we get regular reports from the Canadian Muslim Association, and they're very proactive, and so they'll say what they're doing, how they are planning to do things safely. With some of the other holidays, they had planned things outdoors. But around the gatherings, we know the indoor gatherings in a public indoor gathering is no more than 25 and physically spaced with appropriate indoor mask and other ways, especially if you're sharing the meal. It's similar to how we recommend in any indoor gatherings that it be individual servings, that no sharing of utensils, and that's the same advice we have given for other holiday traditions. But how COVID is spread is going to be the same if people are gathering for Ramadan or whether they're gathering for Easter. Is just make sure that you don't exceed the recommended numbers. You keep your contact small, spaces large, and if you should be isolating, that you are isolating and not attending those events. Thank you.
Thanks, Dr. Kandola. Simon, do you have a follow-up question for either Dr. Pegg or Dr. Kandola?
I've got nothing further at the moment. Thanks.
Okay, thank you. Mario, I think you're the last on the list, but do you have a question for either Dr. Pegg or Dr. Kandola?
Yeah, I do have a couple questions. I think I might have missed a couple of things, so I just want to clarify to make sure. Out of the 24,100 first doses given, how many were given to non-residents or out of work or territories?
Thank you for that question. So what happens is we've administered about 24,000 first doses, 14,000 second doses. So if people were to put it over the denominator of our population of MWT, 34,400, they would get a larger number than 61%. What people have to neglect is there's at least about 4,000 of those people are people who have active healthcare cards from another jurisdiction. So we can't include that number. We have to put, when we're looking at coverage for NWT, we have to look at NWT residents with active healthcare cards over the NWT residents. And we have to remove the number of people who have healthcare cards in another jurisdiction or who are recurrent rotational workers who live elsewhere. So that provides the cleanest coverage that we have for NWT residents specifically, which is why you can see a larger number for first dose provided to NWT residents with active healthcare cards.
I'm sorry, I think you just cut there at the end. Would you mind just repeating that last couple of sentences you were mentioning? I think that's why.
The 24,000 people represent everyone that we vaccinated in NWT, but it's a mix of NWT residents with active healthcare cards, those who are working here temporarily with active healthcare cards from another jurisdiction, and those who live elsewhere who are working here on a recurrent basis. So it's combines all of that. So there's several thousand people who fall in the category of living here or working here with a healthcare card from another jurisdiction.
All right, thank you. Yeah, thank you for that clarification. The other clarification is just I kind of got lost on the time frame of the revised update emerging wisely plan. So that I understand that we're supposed to get more details, but you are expecting some changes in the measures at the end of April.
Yeah, so we will look at phase 3 at the end of April, which is a timeline that's being given consistently. But the phase 3 would be, given everything that's happened the last couple of days, we would do phase 3 in 2 measures. One, looking at easing restrictions to lower risk outdoor gatherings, and then the second one would be easing restrictions to indoor gatherings. And that latter one will be timed at where the vaccine rollout is for the rest of Canada and where the third wave is for the rest of Canada.
Thank you for that, Dr. Kandola, that response. Yeah, we've seen that we're at almost at 2 p.m. I'd like to thank everybody for attending the briefing. Thank Dr. Kandola and Dr. Pegg for their time. And yes, if you have any follow-ups, you can contact me at Darren_P_Campbell@gov.nt.ca. Thank you very much, and have a great rest of the day.